Hi, this is Chris Hicks with the Special Watchdog Report for Friday, July 10th, in which I'm going to dissect the 7 indicators in Mike DeWine's Public Health Advisory System model, of which just yesterday, on July 9th, he claimed Clermont County had exceeded 5 of these measures and as a result needed to be coded red in the model. This chart shows the 5 measures that he says, with X's next to them, that Clermont County has violated. And we're going to dissect how dumb this model is and how easy to manipulate it is by Mike DeWine and his team of political scientists. The model has different levels, level 2, 3, and 4. Level 1 is yellow, then you have kind of orange, then you have the red, then you have the purple. There's no green. So even if you had no patients, nothing going on in your county, you would still be at least yellow. So we are now level 3, which means 4 or 5 indicators triggered. He says we triggered 5 of them, 1 more indicator, and we're in the purple level. Look at the descriptions in this unbelievably awesome model, and imagine submitting this as a college project to a professor. Level 2 is public emergency, increased exposure and spread. Level 3 is public emergency, very high exposure and spread. Level 4 is public emergency, severe exposure and spread. Don't those very clearly tell you the difference between them? They all sound pretty much the same, and that's what makes this model so frustrating. They don't even have hard and fast numbers of indicators that indicate what level something should be at or how they're calculated. Let's start with what Mike DeWine said on the first of those indicators, increase in new cases as it pertains to Clermont County. This is exactly what he said about Clermont County yesterday in his press conference.
During the last 3 weeks, Clermont County's COVID-19 cases increased along with several other healthcare indicators. From June 16th until June 30th, the average new cases per day doubled from 4 to 9. Due to clinical and reporting lags, these numbers may obviously continue to grow for this period.
Okay, so there you have it. He said between June 16th and June 30th. So let's talk about how new cases is measured. I put the information from the state's website at the top of this chart on how we measure sustained increase in new cases. It says, the yellow part, I highlighted it. We look at the increase using smooth analysis or 7-day moving average of new cases and see if there is at least a 5-day period of sustained growth. Well, I downloaded the raw data, which is not very high quality, but it's the best they have off of the state site, so at least I could put it in a chart like this. You have to work it to get it in this format. But if you look at that column that says 7-day average, we, at the beginning of the period that he said, from June 16th through the 30th, we had an increase from, on the 7-day average, from 3.1 down to the 30th there, 9.7. So there was an increase. Does it seem to increase during that whole period? Yes. Okay. Is it statistically significant in a county of 206,000 people? Probably no. And we'll talk about this in a little bit. But if you look at the admissions to hospitals, they pretty much stay flat or the same during that whole period. In addition, if you look at cases daily versus the 7-day average, you see that they trend between anywhere. The low is 3, the very beginning of the period. But most days they're probably between, if you look at this, between 8 and 12. So that seems to be a pretty steady, predictable pattern, not some huge explosion in the sustained increase in new cases. But on this measure, I'm going to say that yes, what Mike DeWine said is true. We have this increase in new cases. So on this measure, I don't like the way it's measured. I don't think it's statistically significant, and the model doesn't address that. You know, what happens if a county went from 1 to 2 cases of a county of 100,000 people? It's statistically irrelevant, but it would still trigger this indicator. But yes, we did trigger this indicator of an increase in new cases. Now let's look at the next 2 measures that he talked about in the press conference: emergency room visits and outpatient visits. So emergency room visits and outpatient visits.
The community continues to experience early signs that more people are seeking medical care for COVID-19 symptoms. More people are visiting their doctors and being diagnosed with COVID-19. Between June 16th and July 2nd, the average outpatient visits nearly tripled from 9 today to 25 visits per day.
Okay, so he said between June 16th and July 2nd, the average almost tripled. Notice he used a slightly different date scale than he used on the prior measure, and we're going to find that as we go through here. They seem to use whatever the date scale is that gets the result that they want to have to trip an indicator. It seems political versus scientific in looking at these date ranges. But let's look at how they calculate these two things. So I included in their information on how they calculate these, there's sort of a header, and you see this, it says for indicators, 4 and 5 symptoms data, and then it has each individual measure. Notice on this one, it doesn't say it down in the actual measurement, but up above, on the top of this, it says that outpatient involves also telehealth. So if you use a telehealth provider and say, I think I have a fever or I coughed 3 times yesterday, that would cause you to be in this measurement. I have no idea how they calculate this stuff. They 10% of the state data doesn't have admission dates correct on hospital admissions. How are they figuring out what outpatients are for every day or for an average? And how are they telling emergency room visits? That would be easier, but it's a very fluid set of information that would be coming in. But let's look at each of these two measurements. ER visits. The state does not have data that lets you look at ER visits. And I think it says ED here. I think that means emergency department in their graph. So their terminology is a little off. But this is from their thing on visits, from the specific data measure off of the Clermont County chart they put out. They separately put out a document for Clermont County. And the bottom line is ER. And I boxed in the time period, okay? And here's the deal. There ain't no sustained increase in ER visits. That varies between, if you look at this period, 1 and 3 across the period. If you look back April, March, it's 0. Probably not reported correctly in the first place. I can't believe there were no emergency room visits. But if you look at this, there's no change. If in fact, in the date range that he said, it's actually a declining trend. So when I look at this, I can also look at the outpatient line, and the outpatient line shows the increase that he's talking about. So it went from 9 at about the beginning of the period to over 24 for one day of the period around July. You can't tell exactly where these are in this chart. And again, there's no raw data you can get to on outpatient visits. But remember, in their own description of how to measure them, anybody that claimed any cold or flu-like symptom or had any breathing issue, they would automatically be coded as a COVID outpatient visit. And also, these numbers include telehealth, which I don't even know how they would measure this. How does this data get reported? It's got to be one hell of an amazing reporting system if, for 206,000 people, if any of us use any telehealth, it gets reported to the government so Mike DeWine can make his chart. So that one, it looks like it did go up, but it seems like pretty much of a bullshit measurement. So let's look at these and update the dashboard. On emergency room visits, I put down, no, we did not exceed the limit on emergency room visits. That was a lie that Mike DeWine said. On outpatient visits, we do have an increase, but I put a question mark next to that because I think it's BS data. And back on emergency room visits, I want to be clear. I don't know that Mike DeWine said a number, but the indicator was triggered in what they released, is that was one of our indicators, and no, it did not exceed that. So emergency room visits, not true. We did not exceed it for the period. Outpatient visits, question mark, because it's a BS measurement with no credible data. And the idea that telehealth is being included and how it's even measured makes it seem even more suspicious as to it being a valid and credible measurement. No data being provided for it really causes me to question where they're getting this data from or how accurate or valid it is. So let's keep going. The next one that he talked about was non-congregate cases. So congregate means nursing home and jails. Non-congregate means not in a nursing home or jail. So let's see what he said.
In recent weeks, over 94% of the cases are not in congregate settings, signaling significant transmission in the broader community spread.
Okay, so he said 94% were not in congregate settings, not in jail or nursing home. Then that signifies significant community spread. Significant. It's unbelievable the community spread that's going on. So this is how they calculate that one, and I highlighted in yellow here. It says a county is flagged on this measure if at least 1 week of the last 3 weeks sees more than 50% of new cases in non-congregate settings. So I put down some comments on this. First, I guess in Clermont County, we need to get more people getting COVID in our nursing homes and in the jail. We got to get these numbers up. We're lagging in nursing homes and jails, and that's causing this indicator to be tripped. That's how ridiculous the indicator is. If you don't have cases in nursing home and jails, and you have any cases not in nursing home and jails, it automatically triggers this indicator. So the third bullet I put here, if you had 1 case not in a congregate care setting and 0 cases in a congregate care setting, this indicator would be triggered automatically because you didn't have a congregate care setting case. So I would encourage public health in Clermont County to start working on getting more cases in nursing homes in the jail. I'm making a joke because this indicator is such a joke. I put the last bullet here. Maybe competent people would consider the percent of the population, congregate and not, that are becoming cases. So in my third bullet point, the example of 1 case in a congregate care setting, in a non-congregate care setting, and 0 in a congregate care setting, that shouldn't trigger any indicator to cause you to go red on some Mike DeWine baloney 7 indicator public health model. That would be ridiculous. The 1 case would not be statistically significant in any county in Ohio, let alone in Clermont County. So this one, here's the way I assess it. I put another question mark. I put the number 2 by it. It's another BS measurement. There's no data that you can validate this measurement, and I don't think it has any relevance as defined. To just be that because you don't have cases in a nursing home or in a jail, it automatically causes you to trigger an indicator if you have any cases not in a nursing home or jail. That seems insane. It seems completely non-scientific, and it seems like something that politicians might like because they can manipulate the measure to be triggered when they want to get over the limit so they can send a message to a county by bumping them up a level. So let's keep going and look at ICU bed occupancy. This is something else Mike DeWine addressed during his press conference specific to Clermont County.
Clermont County also hit a new threshold, of course, as we said, for the overall utilization rate for regional intensive care unit beds, which exceeded 80% during 5 of the last 7 days.
So notice what he said there, 5 of the last 7 days. So some of the measures he's doing on a scale of June 16th to June 30th, some from June 16th to July 2nd. Now this one, the last days. So he keeps using slightly different ranges of dates. Remember, he's also said that the last week or so of data you can't trust completely because it's still being developed. So, but let's dig into this ICU utilization. This is how they measure it, and I put in yellow. A county is flagged on this measure when the regional ICU occupancy goes above 80% for at least 3 of the last 7 days. 3 of the last 7 days. Remember, it says regional, so it's not Clermont County, and it's not COVID use of ICU beds. COVID's not part of the tracking of this. It's just that ICU beds are being used 80% 3 of the last 7 days. So God forbid, let's say that there was an accident, like in a bus or something, and suddenly a bunch of people go in the ICU because of the bus accident, you'd be triggered for this COVID measurement because for 3 out of 7 days, you would have people in the ICU. Let's break it down. If you had 0 cases and 0 hospitalizations, this would still be triggered if in your region, the ICU utilization was 80% plus for the last 3 days. It's a mistake on the chart, for the last 3 days. Even if 0 of the ICU patients were COVID, even if 0 of them were COVID. So it is a preposterous measurement, but let's look at their own data. So this is the data for Region 6, which is Clermont County. And I highlighted in the block there the date range between June 16th and July 2nd. There are 4 days towards the end of that period where it goes over that line, that's the 80% line, and then it starts coming down again below that line. But look at the bottom of this chart, which is actual COVID use of ICUs. From April 6th through July 6th, there's a little bit of time at the beginning where it was above 10%. But throughout the whole rest of that period, the use of ICU for COVID is under 10%. And this is even with whatever measurements they're using. This is their chart. Of course, they do not provide data that you can download to look in more detail as to what exactly is behind these numbers on this chart here. So you just have to take it on faith that this chart is even accurate. But again, it's regional, not local, and you really kind of have to stretch to get that we went over this line because it's only for a few days at the very end of that period. By contrast, actual hospitalizations is a very small number, whether you look at it on a daily basis, which is that in the bracket there, where you see during the very bottom on the second one, on the 631, low numbers and a declining over time 7-day average starting to take place on this data. So the reality is that we are seeing very small numbers of hospitalizations at present, regardless of this Mike DeWine ICU measurement. But I'm going to give it to them. ICU bed occupancy, based on the criteria that they're saying, 3 of I guess any range of 7 days, it triggers that measurement. So that means I got 2 check marks, increase in new cases and ICU bed occupancy, 2 question marks, non-congregation cases and outpatient visits, and 1 no, we were not over the limit on emergency room visits. So that means if I look across all this, we have 4 measurements that were at or over the threshold, only if I include all the 2 question marks. If I don't include the 2 question marks, we're not over 2 measurements. And by the way, did you notice that deaths is not a measurement or a part of any measurement within this model? So again, here are the breakdowns of the indicators. Level 2 is 2 to 3, level 3 is 4 to 5, level 4 is 6 to 7. By the way, isn't it funny to have ranges of indicators on these things? Either it's 4 or more, just make it simpler. So level 3, we end up at level 3 according to this model based on the sketchy data and 2 measures that to me are bogus in the way they're applying them and in how Clermont County is tripping those indicators. The outpatient one and the nursing home and jail rate of cases versus the general population rate of cases. So let's think then that Mike DeWine press conference was on July 9th. On July 8th, 1 day earlier, there was a commissioner meeting and there was an update on COVID. There was no warning in that meeting that we were 28 hours away from getting updated to red. No review of the 7 indicators and where we stood against them. No systematic presentation of data from our health commissioner, and no serious status questions from our commissioners. We still seem to be stuck at the point of worrying about washing hands and wearing masks. So as they sit there wearing their mask with their plexiglass dividers between, acting like it's all important, and they're really on top of it, they're not actually asking any hard questions. They're not actually asking to see a review of the 7 indicators. It is a show. It is a show what is taking place. And how do I know it's a show? Because I can go back and look at during this time period what happened on June 26th, which is during the June 16th to July 2nd time period. What happened on June 26th, also with audio from what happened in the commissioner meeting on June 24th, all part of that range. Let's watch.
Comment, board members, any
We're
comments
listening
today
to
about
audio from
today's
the
meeting?
June 24th commissioner meeting. And we're watching video
To reemphasize probably what Julie said, we
of
need
Commissioner Painter,
to mask and social
Matt Van
distancing,
Sant,
not let our guard
Township
down.
Trustee, and a
Hope
staffer for Brad
everybody can do
Winstrup
that. I see an awful lot of people in the public that aren't wearing masks.
at a Papa John's opening, doing no social distancing, little to no wearing of masks. And in the background, you heard Ed Humphrey talking during the June 24th meeting about his concerns about people not wearing masks. It is a show. If we were about to go red, these people know that there's some serious threat happening. Do you think they would be at a Papa John's opening, not social distancing, shaking hands, not wearing any mask? No, they would not. So hopefully you've enjoyed this dissection of the 5 measures that Mike DeWine says are positive now for Clermont County out of his 7 total measures. And it gives you a much better understanding of how fraught with insanity the measurement system is, and how political it is, how easily it can be manipulated, and how little some of the measures mean to your overall real status as a county. So what has really changed in Clermont County from when we were orange, I guess, to when we were red? To me, basically nothing.